We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabe, the Three Fires Confederacy, Ojibwe, Ottawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation.
Good evening, everybody, and welcome to the November 4th Windsor Regional Hospital Board meeting. Just wanted to get started. Are there any call the meeting to order? It's 5:02. Sorry, everybody, all the viewers at home are a little late. We'll call the meeting to order. Declarations of conflict of interest. Seeing none. Can I get a motion to approve the previous minutes? I have Paul Lachance, seconded by Patty France. Questions or comments with regards to those minutes? Seeing none, all in favor? Perfect. Opposed? None. Thank you. Like I've been doing the last few months, I'm just going to highlight a couple of our partners. So one of the items that I'm going to highlight today is Grow on Windsor. So Grow on Windsor is a men's health campaign that's put on by the Windsor Cancer Center. So Grow on Windsor is a local fundraising campaign created by the Windsor Cancer Center Foundation in 2015. The campaign takes place every November in support of cancer awareness, research, and treatment for men living in our region. Funds raised stay local and help support patients within the Windsor Regional Cancer Center's purview. So that's the one we're highlighting tonight. The other item I'd like to highlight is we still have 50/50 raffle tickets that are on sale. Hopefully I'm not lying here, but I believe we have one going on in November. So please just take a peek at our Windsor Regional Hospital Foundation website. With that, I'm going to pass it over to David Mouche for the President's report.
Thank you, Mr. Chair. This is going to be, once again, a team event. I'll be able to start it off. So what this slide shows is the provincial trends of COVID positive patients since the middle of last month, October, into as of today. And you'll see back in October, middle of October, we had about 500 a day, and the red line there is the numbers in a given day, and they have the 7-day average has started to increase slightly, and as indicated by the provincial chief medical officer of health, and what everyone is anticipating is that cases will rise as we start going more indoors, as it starts getting colder. The extent of the rise we will have to see as we progress, but again, it's more gradual. So as the cases in the community start to go up a little bit, again, trailing indicators will be hospitalizations as well as ICU cases and unfortunately deaths. As it stands now, in hospital across the province, 60% of the patients in Ontario Hospital, not including the ICU, COVID positive are unvaccinated or partially vaccinated. 85% of those patients in the ICU are unvaccinated or partially vaccinated. And we really have to continually look at these numbers because people will say, wow, only 60%, that means 40% are vaccinated. Yes, however, you have to remember the 60% is getting pulled from 26% of the total population that's not fully vaxxed. And if you really look at the 12-plus-year-olds, 16% of the population is not fully vaxxed. So that 60% pretty much is pulling from the 16. The 85 is pulling from the 16 because there's very few kids, if any, in the ICUs. With COVID across the province. So that's where over time, we're going to start seeing more and more of this. Hopefully the cases in hospital and ICU go down. But of course, the breakthrough cases, it's going to eventually, hopefully, as vaccination rates go up, if they do go up, the closer you get to 100%, the more these numbers are going to start moving. Because again, the percentage of the population they're pulling from is going, from a vaccination point of view, going down and down. Now, just to give you some context with respect to what we've done here or what's happening at Windsor Regional Hospital. So we used June 29th as a cutoff. We didn't, go back further than that because arguably you can go back as long as you want. And your numbers, if you claim you don't want to use unvaccinated people, we didn't have vaccines until December of 2020. So, but we picked June 29th of 2021. And since that date, we've had 184 COVID positive patients admitted to Windsor Regional Hospital. 73% of them have not been fully vaccinated. 62.5% of that 73% is totally unvaccinated. Out of that 184, 42 of those patients have been admitted to the ICU. 86% have not been fully vaccinated in the ICU. Again, a high number unvaccinated or partially vaccinated. So again, even though our numbers on a daily scale are relatively small, when you look at them historically going back a few months, the trend that is happening provincially, nationally, internationally, and the message that continually gets sent is that the unvaccinated are the ones who are becoming positive, definitely becoming hospitalized. Definitely, they're the ones, unfortunately, going to the ICU and unfortunately passing away as well. The stats continue all the way through. So I'm going to pass it off to Dr. Saad. One of the issues that seems to have been raised a lot recently is this issue of infection-induced versus vaccine-induced immunity and the difference between the two and the interplay between the two. So I'll pass it off to Dr. Saad.
Thank you, David. You're right. This is obviously a very hot topic now with a lot of people who have had COVID claiming that because they've had COVID and now they have, naturally induced immunity, is that enough to protect them against a subsequent infection? And is that enough to exempt them from potentially being vaccinated? And what we know from emerging evidence, and week after week, another study and another review in the US and in other centers are coming out and strengthening the advice that the World Health Organization, Health Canada, and the CDC are all recommending vaccinations after a natural immunity and after a natural infection. There's many reasons for this. But one of the things that we have to understand, because a lot of times people, and we've had this with our own professional staff who will bring us a lab requisition and show us antibody levels and say, look, my antibody levels are 500. I'm immune. The problem is antibody levels do not give you the full picture of whether somebody is immune or not. That may be true in the first few months, maybe up to 5 or 6 months. But after that, antibody levels will drop in both a vaccinated person and a naturally infected person. But there's another part of the immune system. There's two other parts. One is the memory cells that you make that remember that you had an infection. And then you have a T cell part of it that also helps with infection. And the one thing we know for sure is that if you get vaccinated, the response to vaccination is standardized. Meaning almost everybody, if you give 100 people the vaccine, all of them will have a standard response and they will be protected over 95% from becoming severely infected, from getting into ICU, and from dying. But if 100 people are just infected with COVID, the reactions can be so varied and their immune response is so varied that it is unpredictable. Somebody who has a mild asymptomatic infection may be susceptible within 6 months and maybe 7 months to another severe infection and could potentially die from COVID. Others who have comorbidities also have lower immune responses. And then there are some that are young, healthy, maybe they have a more severe bout of COVID and their antibody levels are slightly higher. Yes, they may be on that same scale. But the problem when you're dealing with a public health crisis like this and something that's more on a population level is you cannot rely on natural infection alone to prove whether somebody is going to be protected long-term and to protect themselves and others around them. And that continues to be why the recommendation from all of these major organizations, specifically World Health and Health Canada for us, that say you need to get vaccinated after a natural infection. The other advantage is we have studies that show that if you've been infected naturally, then you get vaccinated, you actually have a more robust immune response that's even stronger than somebody who just had the vaccine. Now, obviously, nobody would ever recommend getting infected and then getting vaccinated afterwards. But if you have had an infection, you absolutely should get vaccinated to protect yourself long-term.
All right, over to me. So good evening, everybody. So we wanted to give you an update tonight on our OLED Assessment Center and our MET PUMA Assessment Center and where we're standing. So just a reminder, at the OLED Assessment Center, we're focused on ages 18 and above. However, we do see children under that age there as well. Symptomatic testing only and by appointment only. And then that one's open 8 to 3, 7 days a week. And then our MET PUMA Assessment Center sees children 17 years of age and under, symptomatic testing again only and by appointment only. And as of November 2nd, we've seen over 3,500 children through our PUMA clinics, and that we opened that August 31st. And then the COVID-19 symptomatic testing that is available in the community. We just wanted to remind people there are other assessment centers available in LaSalle, downtown Windsor, Leamington, and Tecumseh with MedLabs of Windsor. All of this information is available on our COVID-19 page that you can find if you go to wrh.on.ca. And then last but not least, for myself, as everyone is aware, the province made the announcement the other day that we're opening up third doses for an expanded group. So they are now available for individuals who have received their second dose at least 6 months ago and fall into one of these categories. So individuals that are over the age of 70, so born in 1951 or earlier, healthcare workers and designated essential caregivers in congregate settings, including long-term care, retirement home, and designated caregivers, Indigenous populations, or those that live with an individual that identifies as Indigenous, or those that received a series of AstraZeneca vaccine or Johnson & Johnson vaccine. So those that receive 2 doses of AstraZeneca will get an mRNA COVID-19 vaccine as their third dose. And if you received an mRNA as your initial 2 doses, the third dose will be the same vaccine product as the second dose that you received. And you can get the third dose in Windsor, Essex at the Devonshire Mall, participating pharmacies and participating healthcare providers, as well as pop-up vaccination clinics through Windsor and Essex County. And we did open up our scheduling at the Devonshire Mall location for what day is today? Wednesday. So Wednesday we opened that up. We still have lots of appointments, same day bookings available. So we are encouraging people to book those third doses if they fall into those categories. And over to you, David.
Thanks, Karen. And just so everyone knows, we don't have a date yet for the 5 to 11-year-olds when the vaccines will become available for them. We're waiting on Health Canada approval and then a whole process with respect to distribution. When they are approved, we will be locking down certain bookings for 5 to 11. They are going to be getting priority. So meaning right now, what we're allowing is first and second doses to still walk into the Devonshire Mall. So they have priority to get done. They can book still, but they're allowed, they can walk in as well. Third doses, as Karen outlined, you have to book online. When the 5 to 11s come out, they're going to get priority just like the first and second doses. So not to say we won't be able to do some third doses, but we're going to have a limited availability. So bottom line is if you are, if you're past 6 months post your second dose and you have an opportunity for a third dose, delaying isn't, if you make that decision to delay. But what I'm trying to get at is when 5 to 11s go live, then our limitations on available spots are going to start restricting, and it's not going to be as available as it is now for third doses. So if you have an opportunity for a third dose, do it as soon as that opportunity arises. Get your third dose, again, through the various avenues that Karen pointed out. One of the things I want to highlight, and I want to hand it over to Jonathan Foster after I highlight it, is an issue that our region has been struggling, well, every region pretty much across the world for that matter, has been struggling with due to closures of clinical practice and a move to more virtual visits, especially in the primary care practitioner field. And what we have known and what we're trying to address is this issue of cancer screening. And we're going to focus on 3 significant cancer screens that play a very important role in identifying various cancers at an early stage and possibly making the intervention of the treatment that less invasive and less difficult for the patient, and also more successful rather than possibly catching a cancer late. And what we found is cervical cancer screenings across our region dropped about 37% from 2019 to 2020. There were over 15,000 fewer Pap tests conducted in 2020 compared to 2019. Still, even for this year, 2021, we're still running at about 20% fewer cervical cancer screenings than we did for 2019 when we compared 2021 to 2019. The same applies to colorectal cancer screenings. It fell 41% from the time period 2019 to 2020, with 7,800 plus fewer fecal tests in Windsor, Essex when compared to 2019. The good point about that is for 2021, we are now 13% higher year to date on colorectal cancer screening. So that's good. So we've caught up some, but not the delta. And the average risk for OBSP screening mammographs fell 39% from 2019 to 2020. And it's still 5% lower year to date for 2021. So what we're trying to get across is that the Regional Cancer Program, along with RAMP Clinic, and you'll hear from Jonathan, he'll explain the partnership in Windsor Regional Hospital. What we're trying to do is help out our primary care partners, as well as clearly our patients in our community, and filling in this gap of lost cancer screenings is making up that lost cancer screenings by having blitzes of these cancer screenings. And those people who missed their cancer screening in 2020 have an opportunity to book it as soon as possible and not wait any longer, and have an opportunity to book it on their own if they want to, or working with primary care, book it by calling their primary care practitioner who can book it at this clinic and get it done. Because we know with primary care, trying to get caught up, trying to do more in face-to-face visits, it's going to be difficult to find the time to do all these screenings, aside from just doing the regular annual screenings, let alone doing the catch-up that was lost in 2020. So I'll hand it over to Jonathan and he'll explain in more detail what is happening.
Thanks, David. As David mentioned, we as the Regional Cancer Program in Erie St. Clair have been partnering with primary care throughout the community on screening. And when looking to see how we could set up a blitz or a really focused initiative to catch up on some of this backlog, we developed a partnership with the RAMP Clinic. So that's the Rapid Assessment and Management Program. There are 3 real streams to that. So the first is patients who are unattached, meaning they're not connected to a primary care provider, can book themselves for cervical screening at the RAMP Clinic, either by calling a phone number, and we've got that number, I think, at the end of the slides, or going to getcheckedwindsor.ca. They don't have to have a doctor to book this or a nurse practitioner to book this. They can book themselves, and the criteria are there. The other stream that we're working with is with primary care providers in the community, so family doctors and primary nurse practitioners who might be struggling to schedule patients in for screening through their offices, either through space or through available timing. We will work with them to get their patients booked for the screening and coordinate with them for the follow-up of any positive scans that come through. And then lastly, any primary care provider who wants to partner with us additionally through this stream, we're happy to partner. We have good relationships across primary healthcare teams and are working within the offices to identify patients who are eligible for screening and to support the screening for them. The RAMP clinic is, as David mentioned, focusing primarily on cervical screening, but while we're working with patients, we're looking to see if they're also due for a FIT screening or for mammography. And important features of this clinic are that it is an all-female team of providers and that the services are available in a variety of languages, including English, French, and Arabic. So the process is outlined here on this slide. The patient self-refers by booking directly online or through calling the number. The RAMP clinic conducts the cancer screening, cervical screening at the center, and coordinating FIT or mammography. The RAMP clinic also follows up on any abnormal results. So again, patients who aren't attached to a primary healthcare provider have the assurance of knowing that the RAMP clinic will detect catch the results as they come through and coordinate the next steps. They'll book additional cancer screenings at the recommended times, and then they'll coordinate moving to primary care. So again, if a patient's not attached to primary care, that can be facilitated. If they have a primary healthcare provider, those connections get made. And similarly, a primary healthcare provider can refer to RAMP. They can directly reach out to the team and coordinate booking slots for the patients that they're not able to get into their clinics. So what are the screening criteria? Cervical screening guidelines issued by Cancer Care Ontario are women's aged 21 to 69, and it's a 3-year cycle. So every 3 years, women are getting screened through the cervical screening program. The next one is our FIT testing. Oh, no, this is the data. The data that David talked about is really important here. It's illustrated on the line graphs, I think are the most impactful. The gray line is our pre-COVID line. The blue line really shows where the impact of COVID hit and where we've gone from there. And our yellow line is this current year to date. So although the yellow line looks optimistic and we are making up ground, that blue line is where the trouble is. That represents all of the cases for screening that did not get done in the 2020 year and are cases that are either overdue or not screened at all. For colorectal screening, we use a FIT test, and it's for average risk patients aged 50 to 74. And again, that cycle is every 2 years. The process for this is typically simple. Your primary care provider issues a requisition. The test gets mailed directly to your home. You're able to perform the test in the comfort of your own home, and the results will be reviewed by your primary care provider. So again, through the RAMP clinic, if we are accessing you to provide your care there, we're going to see if you are due for a FIT test, and we'll coordinate that requisition and have the test sent out and help with the follow-up. And if you're attached to primary care, we'll coordinate it with primary care as well. And the data on this is a similar picture. The blue line is the 2020 COVID, the blue line is the 2019 data. The yellow line is our 2021 data. And David mentioned we are doing well this year with FIT testing. Part of the reason for that is throughout COVID, FIT testing was used to ensure that we weren't inappropriately referring patients for colonoscopies that weren't indicated. The FIT test is for asymptomatic, so meaning no symptoms, for those patients that are in the screening ranges every 2 years. And so it was leveraged very effectively throughout that, but we do still have ground to make up there. And then lastly is the breast screening. So mammography is every 2 years, again, for average risk patients, is women aged 50 through 74. We have a number of OBSP, Ontario breast screening sites throughout the region. They're listed there with the contact numbers. So screening, again, can be coordinated through the primary healthcare providers making the referrals, or through the RAMP clinic making the referrals to OBSP. And those sites are all there and ready to provide the screening services for you and connect back to primary care. And the data for, we looked at that already. This is the information for booking an appointment. So it is a really handy and easy reference point. It's getcheckedwindsor.ca or call 519-252-9861 extension 5. It's open Monday through Thursday from 9 to 4:30 and a half a day Friday. You can definitely leave a message. The team will call you back, or you can talk to your primary care practitioner to book that appointment for you.
So thank you, Dr. Saad, Karen, and Jonathan. So very important, if you were due for one of those screenings in 2020 and you did not go because of COVID, or you weren't referred as a result to your primary care practitioner and the closures that occurred in the virtual visits, and not able to get those screening tests done, now's the time. Don't wait. Give yourself an early holiday gift and make an appointment. It's very easy, as stated, to go online to make an appointment. If you do have a primary care practitioner, pick up the phone, ask them to help. They are aware that this is going on. They are aware of the help. They are aware we're trying to help with doing the catch up that needs to be done. And then hopefully we get back on the regular cycle. Primary care offices open up full tilt, and we can go back to quote normal once we make up the quote lost screenings that were done in 2020. So that's the goal. Again, we've made some progress, but there's a whole lot of individuals that missed their 2020 screening and need to have it done. So again, if the screen does identify cancer, it's caught early, and the nature of the treatment is less invasive and less difficult for the patient at the end of the day. So that's our focus. So again, this is something to try to do everything in partnership. Usually, again, with these types of issues, we're pretty much on the receiving end, is we don't see the patient until they unfortunately have been diagnosed, and that's when we see them. Again, as the cancer program and as Windsor Regional Hospital, we're trying to help and put this together with the RAMP clinic. And again, it would be great at the end of 6 months to be able to walk away from this and say, it's perfect now, we're back, we're caught up, we feel confident, we can back out and we can go back to normal. And that's our goal, is just to come in, help facilitate this and move it forward. So that's my presentation, Mr. Chair.
Thank you, David. Does anybody have any questions or comments for David? No, congratulations to the team. Good work on these initiatives. Getting the word out there to get vaccinated. I don't know if you've said it enough or been on enough television programs, radio shows. I think you probably spend more time on AM 800 than Dan McDonald between the three of you. But congratulations. And then, like Jonathan said, please call one of those numbers on the presentation. This is very, very important. We want to get those numbers back up to 100%. Heck, if we can get those numbers up to 105%, that'd be even better, because I'm sure there's a few people out in our community that have been slacking for more than 3 years. So please call the number and get screened. All right, next on the list, if there's no more questions or comments for David, we'll move to the Schulich report. Dr. Jacobs.
Thank you, Mr. Chair. I have a very brief oral report today. Really just an update on how things are going at the school. So I've mentioned before that the medical school is back to fully in-person learning, and that has gone very well with our cohort. Thankfully, I think Western as a whole has about a 99% vaccination rate on campus. And so it's a lovely case study of what happens when everyone is vaccinated, and it is going very well, thankfully. Students have been very adherent to all of the public health's recommendations to keep them in class, and it's been great to have them in class as well. So it really has been going well from that perspective. We do realize that there's some work to do with catching up, because there was there was some areas of our curriculum which we just could not give them as well as we wanted over the last 18 months. And so we're working on some strategies on catching them up, and we have a lot of confidence we'll be able to get through that over the next academic year. So from the teaching and learning at the Windsor site, I am thrilled with how things are going. Other than that, the only other update really is, again, a thank you to the hospital. So fourth year medical students traditionally will travel across the country to get their last year of training and experiences. With the pandemic, those type of travel experiences have all been canceled. And so that meant an increased number of medical learners doing clinical experiences here in Windsor, both for our Windsor students, but also from London. So we've had a significant increase in medical learners on campus over the last couple of months and for the next couple of months. And just like last year, our clinical faculty here have done a great job at finding capacity and providing excellent education. And so we could not have done that without the hospital partners like this. And so I really do appreciate the effort there. And so I wanted to formally thank you. That's all I have.
Great. Thanks, Dr. Jacobs. Questions or comments for Dr. Jacobs? Seeing none. So we'll move on to the financial presentation, treasurer's report with Penny Allen.
Yes. Okay. These are the financial results for the 6 months ending September 30th. So this is the first one, the hospital operations. 2.3 million deficit for the hospital operations year to date. The net deficit after building amortization is 3,158,000. COVID-19 unfunded expenses total 4,258,000 to date. Unfunded non-ministry revenues and unearned volume funding total 6.8 million. So yeah, that's the COVID stuff as well. Second slide, I think, is funding. Yes. All right. In September, we received a one-time funding letter for 709,800 for 3 additional acute med-surg beds to be operational from October 1st to March 31st. Okay, and the Ministry of Health has confirmed that the first quarter incremental expenses submitted will be funded, and therefore $3 million of this funding has been accrued in September. So for revenue down there is base and one-time funding is 15.6 million favorable due to amounts that have been accrued for non-COVID-19 reimbursements. These include the first quarter incremental expenses, temporary physician payments, vaccination and assessment center funding, and nursing extern funding. Okay. Then this one is short here. COVID-19 impact on expenses, 4.3 million year to date in extraordinary expenses for which funding has not yet been received or confirmed. These are for the second quarter incremental expenses. So, wow, yes. And then the expenses year to date. Salaries and benefits combined are unfavorable 4.7 million due to additional staffing for screening, the assessment and vaccination center. Additional med fees, 4.8 million over budget. The 3.8 million are physician fees related to COVID and are fully funded. Remaining variance in diagnostic services as the cost of earning additional patient services revenues. Med surge supply deficit is 1.6 million to date due to higher than budgeted personal protective equipment costs, such as masks, gowns, and gloves. To date, additional PPE costs are 2.5 million. Drugs are unfavorable 828,000 to date, but are offset by higher favorable retail pharmacy revenues. Other supplies are unfavorable by 3.3 million, mainly due to referred out expenses. Note the surplus of 964,000 in utilities due to the continuation of the electricity rebate that we have mentioned before. It did get continued, which was great. So I've done that, and I don't know if you have any questions or comments. Okay, other than that, then I have a motion, which is I move that the financial report with the September 30th, 2021 results presented at the October 25th, 2021 meeting be accepted. It's
Can I
basically,
get seconded by Lori? Questions or comments with regards to that? Seeing none, all in favor? Wonderful, thank you.
I think it's me again.
Yes.
Yes. So all I have for this one is the moving a motion. I move the report for the October 25th, 2021 Finance, Audit and Resources Committee meeting be accepted.
Great, seconded by Ian McLeod. Thank you, Ian. Questions or comments? Seeing none, all in favor? Great, thank you. So in your package, we have tab D, it's correspondence and printed material. That's for your information. We have any questions from the board, comments, concerns? Seeing none. Date of our next regularly scheduled board meeting is Thursday, December 9th. So we aren't the first Thursday, we are the second Thursday of December, just letting everybody know. So please don't show up that first Thursday. We try and do this to reduce the amount of time in between our meetings over the holidays and into that January 1st timeframe. So please remember, mark it on your calendars, December 9th. And then big happy birthdays to Dan Wilson, David Mouche, and Rosemary Petrakis. So happy birthday, everybody. And can I get a motion to adjourn? So I have Paula Shaw, seconded by Cynthia Bisnet. Questions or comments? Well, no questions or comments. All in favor? All right, perfect. The time is currently 5:40. So why don't we meet back here at 10 to 6, if that works for everybody?
Okay. Yeah.
10 to 6. And then if you guys are later, David, we can wait. Perfect. Thank you. All right.